Hi, everyone. Welcome to Gender and Racial Justice in the Supplemental Nutrition Assistance Program, hosted by the Food Research and Action Center. I'm Steve Hayward, Communications Manager at FRAC. Before we begin, I'd like to cover a few brief housekeeping items. We expect this webinar to run about 60 minutes. We are recording the presentation and will send the recording and slides in a follow-up email. Feel free to introduce yourself and your organization in the attendee chat. We'll have time for questions and answers at the end of the presentation. To ask a question at any time during the webinar, please use the Q&A panel in the bottom left-hand corner of your screen. With that, I'll pass it off to Alice Spina, FRAC SNAP intern. Take it away, Alice.
Thank you, Steve. Hi, everyone. My name is Alice Spina with the Food Research and Action Center. Thank you for joining us today for our discussion on gender and racial justice in SNAP, which will build on the themes that we are exploring in an upcoming brief under the same name, written by the National Women's Law Center and FRAC. For those of you who are joining us for the first time, FRAC is an organization that works to improve the nutrition, health, and well-being of people struggling against poverty-related hunger in the United States through advocacy, partnerships, and by advancing bold and equitable policy solutions. We conduct research, advocate for federal, state, and local policies, and provide coordination, training, technical assistance, and support on hunger-related issues. Today, I'm going to start us off with a high-level overview of SNAP for those of us who are new to the anti-hunger space. Then Courtney Anderson from the National Women's Law Center will walk us through the themes that are explored in our upcoming brief. We'll follow that with a friendly but robust conversation with our panelists, who I'll introduce shortly, and end with the Q&A session. So feel free to submit any questions you have for us in the Q&A section of the webinar. SNAP, the Supplemental Nutrition Assistance Program, formerly known as food stamps, is our nation's first line of defense against hunger. It's the USDA's largest food and nutrition assistance program by far. SNAP feeds over 40 million people a month, reduces the prevalence of food insecurity by up to 30%, and in 2022, lifted 3.7 million people out of poverty. SNAP benefits are transferred onto EBT cards of program participants at the beginning of each month, with an average benefit amount per meal coming to $2.84 as of May this year. That number can be lower or higher depending on the specific circumstances of individuals or households. As of right now, SNAP benefits can be used to purchase fruits and vegetables, meat, poultry, fish, fresh, frozen, and non-perishable foods, not hot or prepared foods like rotisserie chickens at this time, just to note that. You can purchase dairy products, breads and cereals, snack foods, non-alcoholic beverages, and seeds and plants that produce foods for the household. I include this next slide just to highlight the fact that SNAP is a very popular program among American voters. The figures are from a Data for Progress poll where researchers asked likely voters about their thoughts on SNAP. I dropped a couple of graphics below, but the main points of their survey identified that voters across the political spectrum have a highly favorable view of SNAP. They overwhelmingly think that SNAP benefits are too low when they're presented with the dollar per meal amount, and 2/3 of voters support an increase in federal funding to SNAP. A link to this data will be made available at the end of our presentation. And with that being said, please allow me to hand this off to Courtney, who will talk to us more about SNAP through a gender and racial justice lens.
Thanks so much, Alice. Good afternoon, everyone. My name is Courtney Anderson, and I am the Social Insurance Legal Fellow for the Income Security Team here at the National Women's Law Center in Washington, D.C. And I just wanted to start by saying thank you to FRAC for working with us on this amazing issue brief and hosting this webinar. I'm so excited to be here and discuss it with everyone. So this year, in collaboration with FRAC, we decided to update our 2020 Gender and Racial Justice in SNAP issue brief. I want to quickly do an overview of the brief's main themes before we dive into specific aspects of it during the discussion. So first and foremost, one of our main goals going into this process was to highlight the critical role that SNAP plays in alleviating the food insecurity that historically marginalized groups are more likely to face. Most SNAP recipients are women, and we knew it was important for us to focus on that, especially at its benefits for women of color, older women, women with disabilities, and LGBTQIA plus people. In addition, providing evidence of SNAP's positive influence when looking at health and education outcomes was also a crucial part because the good that the program does, extends wide and far. So it was necessary to show that through the data as well. Now, despite all of the good that SNAP does, there are still several barriers that make it harder for marginalized groups to access it. So, detailing that reality in the brief was, a must. We wanted to delve into those barriers and their impact on these populations, because discussing the challenges, and how different they may be for the different groups is how adequate improvements, to the program can be made. And that brings me to the end of the brief. The brief, essentially, it concludes with policy solutions that will be beneficial to lawmakers as they work to improve the program and expand its reach in supporting more people experiencing food insecurity. And I'll just finish with this. This brief was an opportunity for us to touch on why the SNAP program is so important, especially for vulnerable populations, while also addressing the fact that, challenges still persist in the administration of the program. And as a result, more should be, done to ensure that the program is improved for all of its recipients, but especially for those who are facing multiple forms of discrimination. So, those are the major concepts that we discussed throughout the brief, and we're really excited for everyone to read it. Thank you, Alice.
Thank you, Courtney. And before we begin, I would like to, hold on a second here. I would like to introduce today's discussion panelists. As you just heard, Courtney is with the National Women's Law Center as a social insurance fellow. We have Alyssa Schmier with us today as the Vice President of Government Relations and National Budget at MomsRising. Irene Lewis is here with FRAC as a SNAP analyst. And following our conversation back and forth, we are going to bring in Stefano Mancini, our Emerson Fellow with FRAC, to lead us with our audience Q&A session. So, Alyssa, my first question today is for you. Before I begin, did I miss anything in your intro?
Nope, you covered it all.
Okay. So there are many high priority issues that require attention today, of course. Why should we care about food security right now?
Yeah, of course. Well, I think it's especially important. I'm so glad so many people can join us today to kind of talk about this issue, since, as you mentioned, there are a ton of important issues that are happening right now and taking up space in the policy world. But food insecurity matters because it impacts so many women and children. According to the USDA, more than 34 million people, including 9 million children, experience food insecurity in the US. And household food insecurity rates for households with children headed by single mothers or women living alone, in particularly women of color, LGBTQ+, and senior women, are especially high. So food insecurity, we know, impacts women's health immensely, as well as our ability to work, attend school, and raise our children. We know that nutrition assistance programs like SNAP in particular are game changers. It's one of the most successful programs we have in combating hunger and has a proven track record. Mothers of young children in food insecure households who receive SNAP were less likely to experience symptoms of maternal depression, less likely to be in poor health compared to mothers in food insecure households not receiving SNAP. We know that birth outcomes improve when mothers are receiving SNAP and WIC, which we won't be discussing as much today, but we know those together are very powerful. And children do better in school. Nutrition assistance allows women to use their income for other priorities like childcare, housing, clothing, and medicine. So, those are some of the reasons why we think it's so critical to look at this issue from a gender and race lens.
Okay, so thank you. I think you just answered some of my my next question for you, but just to comment, a lot of the health conditions that you mentioned, I know that food insecurity causes an increased risk for chronic health conditions like diabetes, obesity, heart disease, mental health disorders. And we are behind on the research in, women and in racial and ethnic minority populations. So if we're able to solve that problem through, something like, SNAP, as we're talking about, we'll have more time to look into stuff like that as we go ahead. My next question is for Irene. In what ways has SNAP in its current form helped to reduce disparities?
Thank you for that question, Alice. Again, my name is Irene Lewis. I'm a SNAP policy analyst at FRAC. So as was previously mentioned by everyone who has spoke thus far, SNAP is a really critical program to over 40 million people across this country. And it reduces food insecurity, especially among the most marginalized populations. And so we saw in 2022 that SNAP lifted, like you said, nearly 3.7 million people out of poverty, including 1.3 million women. And that was in total 1 million more people than in 2021. And so we've seen over the past, I would say, especially since the pandemic, as different flexibilities have been made available, that SNAP has been able to reach more people. Someone also mentioned that as SNAP is administered on an EBT card, it allows a household's income to be made available for other purchases like childcare, medical expenses, or education. So as a program, it helps to lift households out of poverty by shifting their income so that they can be able to meet their basic needs. Additionally, SNAP has been found to reduce risk for chronic health conditions like diabetes, as was mentioned, and can help reduce healthcare costs since addressing someone's food insecurity is a preventative measure. And so I think currently, as it's available, SNAP is shown to be a really effective program in both lifting households out of poverty and increasing opportunities for economic advancement and improving health and education and economic outcomes for households.
Thank you, Irene. I couldn't have said that better. I have a question that I would like to put out to the panel to see if you have any thoughts. Otherwise, I can comment a bit on this. In what ways is SNAP falling short for women, LGBTQIA plus people, people with disabilities, people of color, and older people? Like, what types of things are we seeing that we can improve on at this point? I know we'll have Courtney talk a little bit on this later.
I mean, one thing at MomsRising here is a lot, we collect stories from SNAP recipients who are members. And because of some of the changes that happened in the past year or so, basically the changes, there was like a boost in SNAP benefits and wider availability during the COVID years, and that went away. So we've seen a massive reduction in benefits, people who are covered, how much they're getting. We hear a lot from people that say they still are having trouble putting food on the table, even though they're receiving benefits, because they've had cutbacks to their benefits. We've had some people get kicked off the program altogether. So there's still that kind of gap. And obviously there's an ongoing problem within the SNAP program where people are having to choose between making slightly more money or taking a small promotion, which will then either reduce their benefits or kick them off completely, but they're not making a livable wage anymore. And this impacts so many women. And that's obviously this kind of SNAP cliff that we talk about of, basically you earn like a couple dollars more and you can't no longer qualify for the program. That's a fix that we're continuing to try and advocate for.
Thanks. And like around the SNAP cliff level, we do see that women are overrepresented in the low wage workforce. So the unstable and unpredictable work schedules and, having access to less benefits like paid sick leave can complicate things when it comes to time limits and work requirements and stuff like that. Does anyone else have anything to add to that?
Yeah, I think exactly what you said, things like additional work requirements and time limits on how long a person can access SNAP based on having shown documentation of sufficient work hours really puts households at risk of being able to access such a critical resource. We too, Elsa's point, made a great point earlier. During the pandemic, we saw a ton of flexibilities, like those time limits being temporarily paused and not being implemented. And so folks were able to still receive their SNAP benefits while we were going through an economic downturn and we saw high rates of unemployment. When those time limits were put back in place sometime last year, when the public health emergency ended, we were at risk of thousands of households not being able to get benefits anymore. And so when we talk about policies that really support women, especially who are overrepresented in low wage jobs, having access to SNAP, things like ending time limits and work requirements, or increasing the income eligibility requirements through things like broad-based categorical eligibility are super critical in supporting women, working women, women with disabilities, older adults, and LGBTQIA plus folks.
Yeah, thank you, Irene. Let's move on to the next one here. One that I have for Courtney. We see higher SNAP participation rates among women, people of color, LGBTQIA plus people, and disabled people. Why are these groups more susceptible to food insecurity in the first place?
That's a great and important question, Alice. I think the answer begins with us looking at the fact that all of these different groups disproportionately face economic insecurity and poverty. Gender, racial, and other forms of discrimination across our education, housing, and healthcare systems increasingly undermine these groups' ability to make ends meet. And so when you experience a lifetime of systemic disparities, you're more likely to end up in poverty, which is inextricably linked to food insecurity. So for an example, for many people living in poverty, allocating a significant portion of their income towards basic needs like housing, utilities, and healthcare leaves little room for purchasing nutritious food. Then you also have the fact that low-income neighborhoods, are more likely to be situated in areas where, with limited access to grocery stores that offer a variety of fresh and affordable produce. And I also have to, mention how the pandemic further exacerbated, the economic insecurity for a lot of these groups, especially women of color. Decreases in income and resources alongside, the increase of household goods, left many women of color and their families without enough food to eat. So, the pandemic and its continued aftermath has become another barrier for many of these groups to overcome. So, when you look at continued systemic discrimination and the lasting effects of the pandemic, our most vulnerable populations, like the groups you named, will be more susceptible to poverty and food insecurity and rely on SNAP benefits more than others.
Thanks. And this question kind of builds on the, what you just answered here. The brief finds historically marginalized people face specific barriers to accessing SNAP benefits. Can you give us some examples of these barriers? I know you mentioned COVID and a couple others.
So like I mentioned, so poverty, these different groups, are more susceptible to poverty. So poverty hinders educational attainment and limits, employment opportunities, further contributing to food insecurity. People who grow up in poverty may face inadequate access to quality education, which limits their prospects for good paying jobs and economic mobility. And like we've mentioned the pandemic, but the economic downturn was even dubbed, a C-section. So, for its disproportionate impact on women, especially women of color. It primarily hit like the service sector, where women are overrepresented, like we've stated, due to, occupational segregation and caregiving responsibilities forced a lot more women than men out of the labor force, especially women of color. So these combined realities, cost more women to lose jobs than men, which, results in poverty and, food insecurity.
Yeah. Thank you. And I know that with some other groups that we, will mention in the brief moving forward, we have some access issues, like at the point of access for applying to SNAP benefits, for receiving SNAP benefits for certain populations. I know that formerly incarcerated people are prevented in some states from participating in SNAP if you have a felony conviction, felony drug. LGBTQIA people report facing discrimination during the application process when they are using their benefits, and sometimes with like identification if their ID doesn't match their gender identity. We also see some barriers with domestic abuse victims and victims of sexual assault. If you don't have access to your documents, or if your housing situation is up in the air, that prevents some barriers. And as far as like the application process, again, which I think we'll go into further, it can be a barrier submitting, all these documents, going through a process that can be complicated if you are an older adult, if you have disabilities. So that's some stuff that, currently we can work to improve here. And the next question I'd like to pose to Irene, what policy changes could help to ease food insecurity for women, LGBTQIA+ people, and people of color, especially those facing multiple forms of discrimination?
Yeah, I think you set the question up beautifully, and I'm focusing specifically here on SNAP. I want to break up the answer into what are some federal changes that sort of need to take place, and then what are changes that can happen at a state level. But federally, there are some things that we're pushing for, like ending the time limits or removing the ban on folks with drug felon convictions. A lot of these policies and ending those arbitrary time limits to SNAP benefits, a lot of these policies being rooted in deeply racist assumptions about SNAP recipients and about low-income households. And so we're actively pushing for policies that will in those harms at a federal level. Additionally, USDA offers states different sort of waivers. Like we saw in the pandemic, states were able to take different flexibilities to make it easier for folks as they are interacting with the SNAP application or with their recertification processes. So things like making the recertification process longer. So instead of a household having to go in every 6 months to recertify for SNAP, being able to recertify for a 12-month period. Those are some examples of administrative flexibilities that the federal government offers to states. Another thing that we talked about earlier that's super critical is increasing the income threshold. So federally, the income threshold for SNAP is 130% of the federal poverty line, but states have the opportunity through what's called broad-based categorical eligibility to increase that to up to 200%. And that really supports households where, like folks mentioned earlier, when folks want to or are seeking to earn a little bit more income, but that income does not make up for losing all of their SNAP benefits if they become ineligible. Another policy change that needs to happen federally is removing the 5-year bar on specific immigrant groups to SNAP. Certain immigrant groups have to wait 5 years before they can become eligible for SNAP. Undocumented folks are not eligible for SNAP. And so there are things that folks can do at a state level, like focus their outreach in specific communities that may serve immigrant women disproportionately, or that may serve immigrant women at a higher rate. But there's also things that state agencies should do, like ensure that materials and applications are in multiple languages. USDA has charged state agencies with doing things like that. And then there's things that need to be changed at the federal level to make SNAP a more accessible program, like ending the time limits, removing that bar on immigrants, and ending the ban on folks with drug felon convictions. So those are examples of a few policies, but I know when the brief is released, it'll go into much more detail. And so I'll just present those for now.
Thanks, Irene. That was a great list of points here that, changes that we can make at different levels, which is something that we'll really have to do moving forward to make a lasting impact. Another question for Alyssa. How can communities and advocacy organizations speak out and advocate on the needs to strengthen SNAP and remove roadblocks to anti-hunger programs? Like, how could I take action on this in the next couple months?
Yeah, excellent question. Basically, any way you are able to plug into this conversation, we would strongly encourage individuals and groups to do so. There's a lot of different ways to work SNAP advocacy into the work that you're already doing. So if you're putting together priorities for the fall, or you have a newsletter that you're working on, or if you're putting together, kind of leave behinds for elected leaders, educational materials, include a section, even as much as like a line about food insecurity and among women and people of color, and making sure that they're, strengthening SNAP, providing full funding, and removing barriers. You could keep it very vague like that. We also strongly encourage groups that are able to use storytelling to connect storytellers with elected leaders. So that could be setting up meetings. You can record short videos and send it directly to members of Congress. You can post on social media. You can use those stories and letters to the editor and op-eds. Storytellers deeply enhance site visits and town hall meetings, anything like that. I think that showing the diversity of the type of storyteller, people who use the SNAP program, a range of age, all that type of thing is incredibly beneficial. And you could write letters directly to members of Congress about food insecurity in your community. Obviously, the resources that you see here today, you can lift out these stats as well, post them on social media and tag folks. I think in general, just making sure that decision makers understand that we're kind of paying attention, we're watching, and this is one of the issues that we're closely tracking, is incredibly important, especially if you're an organization that doesn't traditionally be seen as an organization that might work in the hunger space. It's really great for them to hear from business leaders, women's organizations, children's group, health advocates, doctors, nurses, school teachers. I think that type of diversity, showing that this is an issue that impacts so many parts of our local communities, and those not the usual suspects type of advocates is particularly strong.
Yeah, thanks, Alyssa. And I think that storytelling is so important because we're up here, speaking as experts about this issue. I am on the SNAP team with FRAC, but people who are accessing the benefits right now, have access to the benefits and have experience with that, are really experts on the point of access and how this stuff works in the real world. So getting that information out there beyond just, looking at charts and data and stuff like that is really important. So we have to lift up those voices, use those anecdotes in order for people to have a real understanding of the program and how it works. And I think you all answered my questions here. Are there any other points that any of you would like to add before we take some audience questions?
Yeah, actually, I did want to talk a little bit. I forgot to also mention one of the biggest ways in which we can ensure that SNAP supports women is through benefit adequacy. And so making sure that SNAP benefits meet the nutrition guidelines and cost of food that exist out there. And so we saw that in 2021, the update to the Thrifty Food Plan was really critical in ensuring that SNAP benefits were sufficient. The Thrifty Food Plan is one of 4 USDA food plans that is used to drive SNAP benefits. And for the first time since the creation of the Thrifty Food Plan over 50 years ago, it was updated without being cost neutral, which meant that households were really able to see a real-time impact on their EBT cards and the amount and how far their benefits were able to go. And so I think as we're talking about policy changes that are made, I think keeping any future Thrifty Food Plan updates, making sure that they are able to reflect the cost of a nutritious diet for households will be super critical in supporting women and LGBTQ plus communities moving forward.
Yeah, thanks. And I know that the Thrifty Food Plan is supposed to take into account like inflation and stuff like that. We have seen prices really skyrocket since the pandemic or since the end of the national emergency. So I know that some research is, identifying more than just inflation as part of the prices rising. So it is really important to stay on top of that and keep those, updates coming, keep it on our minds. Anything else from you guys before we take some audience questions? All right, so and I would just like to remind you guys, feel free to submit any questions you have to the Q&A tab. Stefano, you can take it away. Thank you.
Awesome, nice to meet everyone. My name is Stefano. I'm the Bill Emerson National Hunger Fellow on the SNAP team at FRAC, and it's been an absolute pleasure to work with FRAC and advocate for strong SNAP. Luke has a question. He asked if there's any data or research on the inequitable impact on asset testing for SNAP.
I'll just say that in our brief, we discuss how asset limits, tend to discourage savings and leave families with low incomes more vulnerable to financial emergencies, such as, the sudden loss of a job, an unexpected medical bill. They can also force, some of those families to choose between owning a critical asset, such as a vehicle they need to get to work and receiving the SNAP benefits they need to put on the table. And this is really, harmful. 77% of low to moderate income, U.S. households are asset poor, meaning their household, lacks assets to provide subsidies at poverty level for 3 months, if their incomes were cut off. So, the asset limits are very, very harmful for, low income families, who are trying to choose between, the SNAP benefits that they need and the critical assets that they also need. So I don't know if anyone wants to add anything else.
Yeah, I was just gonna add things like cars are critical for people to be able to get food and get to work and bring their children to childcare and things like that. And so things like asset tests that really limit a household's ability to have multiple cars or a stacked savings account to be able to pay for emergency expenses are super detrimental, and allowing households to move out of poverty. And so states have been able to either raise their asset limits or completely remove their asset tests through broad-based categorical eligibility, which again is the same provision that allows states to raise their income tests. And so some states do not have asset tests. Some states have tests that are higher than what is federally required. So there are pathways for states to make it easier for households to have savings or to have vehicles or to have other things that allow them to keep food on the table while also going about their daily lives.
All really great, important points. We've got another question. What can be done at the national level to ensure that women of color with trauma are not being re-traumatized when they interact with government agencies to apply for and renew benefits?
I can jump in with this one. I think that one piece that it's a great question that we should all be advocating for is passing and strengthening categorical eligibility. So categorical eligibility, CAT-L, basically, people who access food stamps also access a variety of other programs many times. So if you are filling out the paperwork for anything that includes, your income eligibility, your social security number, your address, things like Medicaid, WIC, SSI, TANF, etc., they already have that information. And the best thing that could be done is for our government agencies to kind of have it a one-stop shop where it feeds it into a computer and you are able to be enrolled in all the various programs that you're eligible for and want to get. And that, I think, will not only cut back on paperwork and the time-consuming aspect of signing up, applying, and renewing benefits, but it also could have the positive effects that people who have trauma or disabilities, a variety of reasons of why it could be a huge burden, not to mention the fact that caregiving and work and school requirements make it hard to apply and renew for all these benefits. Categorical eligibility could help with that trauma aspect as well, because the way it should be is that you sign up for one of these things and you automatically can be enrolled in a variety of other programs as well.
Yeah, really important points there. We have another question about how advocates can get involved. Will FRAC be organizing a Hill Day for advocates? Is one already planned?
So we just had our latest lobby day early last month at our national anti-hunger policy conference that was in DC, and so that it will be another opportunity in the future. But I think in the meantime, if you visit FRAC's website, there's a ton of opportunities to be able to engage with members of Congress on these issues, and we have a ton of resources available. So I can maybe put that in the chat for folks if they're interested.
Fabulous, yeah. We have another question specifically about college students. It says college students are also another underrepresented population that often do not qualify for SNAP unless they participate in work study or at least 20 hours a week of work. Many college students have family demands or heavy coursework loads. They may not be able to work for those reasons, or they can work only less than 20 hours. What efforts are being made on a policy level to increase SNAP eligibility for college students?
I can take that one too, and maybe pass it to either of you. But so as the person, I think Marian mentioned, the eligibility rules for college students are pretty complex. Students have to meet one of several what are called exemptions. A couple examples of an exemption are you are working 20 plus hours a week, you're participating in work study, you receive another program like TANF, you are under the age of 17 or over, I forget the upper age limit, but it's a pretty complex process for college students. So federally, we are working on advocating for removing that student rule that requires students to meet an additional exemption and allowing students to be able to access SNAP like the rest of the population by meeting the general income and assets and traditional standards that other populations have to meet.
And I think the other thing to keep in mind when you're talking about food insecurity among college students is 1 in 5 college students are actually parents. And so I think that we need to shift our thinking a little bit about what a college student looks like in America today and what type of supports they might be needing in order to get a degree or an advanced degree and support their family at the same time. I've seen it called non-traditional college students before, but we have tons of MomsRising members who are in some sort of post-secondary education program, and because of that and their inability to work full-time and their caretaking needs, they need to use food assistance programs. And so I think that we just need to make sure that when we're describing the problem, we're also talking about the population accurately.
Yeah, and to your point, more students are likely to be parents. More students are also likely to come from or be first generation, so to have come from households where their parents had not gone to college. More students are more likely to be from low-income households. There's more immigrant students than ever. So we're seeing a population of students that don't match the population of students that existed back in the 70s when these rules existed. And folks assume that students were temporarily low income because they were not living with their parents. More students today are having to fund their own education as well as keep food and multiple jobs to keep food on the tables for themselves. And so it's really important that you made a great point to make sure that when we're talking about college students, we're not talking about a middle class person who was between the ages of 18 to 22 was left home to go to school. We're also talking about someone who could be 40 and going back to college, or somebody who is first generation and has never interacted with those systems before. So thank you for bringing that up too.
And you guys can correct me if I'm wrong. Irene, you might know this, but we've seen some talk at the federal level about there being exemptions made for students who are former foster youth. Is that related here?
So that is, yes, but that's also related to, those are some federal efforts happening.
Sure.
I think at the crux of it, we are really hoping for all students to be able to access SNAP. But related to former foster youth, there's also some provisions that happened last year that allow former foster youth that they were not subject to the time limit. So that time limit that we talked about earlier, where folks could only receive SNAP benefits for 3 months in a 3-year period if they were not meeting sufficient work hours. There were some provisions that were passed, I think last year, that allowed former foster youth to not have to meet those requirements. So we're seeing, I think at a federal level, some pushes towards making SNAP more accessible for specific populations. But when we're talking about making SNAP an accessible program, we want to ensure that no one is being hindered by something like harsh time limits.
Thank you.
So we've got a really interesting question here, specifically about Arizona. So they are people who grow their own fruits and vegetables, can sell it in farmers market without needing a permit from city government or the health department. And so it helps farmers markets, especially in rural areas where people have access to SNAP, but they don't have a place to spend it. And is that something that we can advocate for nationally?
So I can share one resource that I think FNS put out. I need a second to find it really quickly, but I think FNS put out a week or two ago where you can there's a map available where you can find farmers markets that do take SNAP benefits. Additionally, some states offer what's called double up bucks or the BestNet program, which allows, it provides a $1-to-$1 match for folks to buy fresh produce, either at markets or stores. And so that is a program that is being expanded at a state level that I think might be of interest. But yes, I will find the link to that map and also put it in the chat.
And so we also have a question here about Project 2025 and how that might impact SNAP.
So in a totally see-through educational way, Project 2025 is put together basically by the Heritage Foundation, and the Heritage Foundation has a long-standing position of basically shrinking funding and putting up barriers for SNAP recipients. And so I think that they want to do away with the thrifty food plan. They want to put stricter work requirements in place. I believe that they would want to reduce the amount of funding. I'll drop into, in general, they want to shrink the safety net, social safety net. So SNAP would kind of fall under that. I can put into the chat an article that I saw the other day that kind of walks through some changes, and there is a section on nutrition assistance. But in general, it follows pretty tightly in line with what the Heritage Foundation has been advocating for many years around food stamps, which is in direct contrast of many of the provisions that we're discussing today.
Yeah, I think to add to what you were saying, a lot things like time limits. We've already talked about how they disproportionately impact women and women with disabilities and older adults. And so I think it's really critical that as we look to the future, we remember that any cuts to SNAP benefits are unacceptable. Any efforts to weaken SNAP is unacceptable, and that we have to continue to push Congress and any future administrations to continually protect and strengthen SNAP.
All right. Does anybody else have any questions they'd like to put in at the last second here? If not, we may be able to give you guys some time back today. Feel free to shoot anything if you think of it. But in the meantime, before we close out, I'd like to bring your attention to some resources that are included in the slides that we will give you access to after our presentation. The first link is to the original Gender and Racial Justice in SNAP brief that was put out by NWLC in October 2020. It still has some great resources in there, and the updated brief will be published sometime in the next week or so. Let me see. I think something just came through for Irene here. Are the admin flexibilities that you mentioned offered to all states? Is there a reason states wouldn't use the better options at all times?
Yeah, it's a really great question, and I think one that at FRAC we're constantly working on and exploring. The short answer is yes, but the longer answer is that it really is up to the state to seek to avail themselves of those options. And so at FRAC, we really work closely with advocates to support them in their efforts to work with their state agencies to seek out those options. A lot of times it has to do with political feasibility. And so we're really happy to work with you to talk through specifically how that might look in your state. So you can feel free to reach out to me. I'll put my information below your question so that you can reach out if you have any more questions.
Yeah. Thank you, Brendan. And if we have no more questions here, let me see. We have the brief link here. We have a webinar link for something that we put out last year on gender and racial justice in the context of the Farm Bill. That's another great resource. The last link is for the Data for Progress polling that I referenced earlier here, so you'll have access to all of that. And that concludes our discussion today. I'd like to give a round of applause to our panelists. Thank you for being here and helping us to move this conversation forward. I'd also like to thank our audience for taking the time to hear what we have to say. We're really lucky to have advocates like you who are willing to dig deeper and understand the structural inequities we're facing today in our society. So we commend you for putting in the work to eliminate disparities where you can, whether it's in the anti-hunger space or elsewhere. Again, thanks for everyone for being here. Please keep in touch, and I hope you have a great rest of your day. Thanks.